Our next guest this week is Dr. Nema Runyan from Elite Health. Welcome to the show, Doctor.
Thank you.
And this is the first of a few visits, so I look forward to hearing all about what you do. And we're going to start with how to keep safe, keep yourself safe, and participate in your health care.
Very important.
Okay.
Both of these are very important things, and they go hand in hand. When you participate in your medical care, you're often safer, and you're more often on your way to wellness, quicker and easier.
Okay.
One of the most important things that I found in my years of practicing medicine is that medication safety is paramount. When I see people in the office, the confusion never ends. There's lots of different ways that a patient and the doctor can be confused about the medications.
Okay.
And I think it's very crucial that the patient and the doctor form a partnership. All eyes on those medications. There are two components to a partnership. One, what the patient can do for themselves to keep themselves safe, and then what the doctor does to keep their patient safe as well.
Okay.
So the first thing, though, I want to empower all of our listeners here to know their medications. They need to know the names of their medications. Oftentimes, there's two different names. One is a chemical name, and the other is the brand name. Very important. If you are ingesting anything on a day-to-day basis, putting it into your body, it is so important that you know the names, both names, so you don't get confused. So if they give you the brand name, you say, oh, that's my medicine.
Okay.
Or if they give you the chemical name, you say, that's true, I know this is my medicine.
Okay, what's the best way for somebody to keep track of that?
Well, now this is where the partnership comes in. When you see your primary care in the office, there is no better time than to ask, what are these medicines I'm on, and why am I on it? So ask, and keep asking. If you don't understand, or if you go home and say, oh, I'm confused about that, go back again. You can even make a visit specifically to discuss your medications and why you're on them. You know, maybe your primary is a little rushed. You can actually make a visit for medication review.
Okay, with you?
With
you,
me,
or?
with most primaries would welcome this. I don't know if any primary that would say not, but it's very important that you know the medication's names, the doses, and the frequency that you take them.
Okay.
Now, it's very good for a patient to have actually it written down. If you're electronically savvy, you can put it on your phone.
Right.
But nothing tells a tale of your health better in a crisis situation or in a unexpected health event than to have that medication list on your person. And I tell all my patients, pen, little index card.
Right.
Here's the medicine,
Yeah.
here's the dose, here's how I take it. Tells volumes about your medical history without you even having to open your mouth.
I think having it, if you, like you said, on your phone, in case of an emergency, all that information is
there,
ready, available to anybody that needs it.
For our men, inside their wallets. They're, you know, people go through your wallets. For our women, in our purses, if they're not in a purse, in a pocket. This is very important, I think, very important. And it's so easy to do, so easy to do, so easy to do.
Okay.
Then the next thing I think is very important is at that doctor's visit. Now your partner is your physician. The doctor needs to have a review of your medications every single visit.
Okay.
Every single visit.
And when you say all medications, is that probably supplements you're taking or vitamins, like everything? They need to know everything.
Everything.
Okay.
So it's prescription medications, it's non-prescription, over-the-counter, it's supplements, because you would be surprised in the years that I've practiced, people can develop a sensitivity or an adverse effect, not really to the chemical in the pill, but the pill, what it's made out of. Very strange. but it takes a lot of investigating. You're almost like Sherlock Holmes.
Oh my gosh.
But it's that supplement or that over-the-counter product that they never thought to tell me that's giving them the sensitivity or the rash or the stomach ache.
Because how could a supplement be so detrimental, right? So these are the things you need to know. Why everything that you ingest, like you said, it's your body. You need to know what's going on.
That's right, because when we put something in our body, what we have to remember is this. If it's not nature-grown food substance, any and everything may or may not cause a reaction in us. We can be allergic to it, flat out allergic, in doctor speak, or we can be sensitive to it and have sensitivities to it. So thinking that something over the counter or because it's a supplement or because a doctor isn't prescribing it, it's just totally safe is a inaccurate way to think. Because you can have side effects and adverse reactions to anything you ingest, anything and everything. And we find that as we age gracefully, that these sensitivities
become more acute.
They can.
Or they do, or they develop out of nowhere.
They develop out, it seems like it develops out of nowhere, but it's been easing up on us. But we need to be mindful and aware. And I think that the partnership between the physician, the patient, and our pharmacist, it's also a very safe thing to get all of our medications, prescription medications at one pharmacy. That makes my job easier. That makes it safer for the patient because there's one database where any doctor that is giving and prescribing medications, when you go through one pharmacy, that pharmacy is going to have knowledge of that. And of course, there's a written database.
And they can keep track of the interactions so that if everything's in one place, there's no confusion. Great. Well, thank you. Oh, I'm sorry.
No. And the more eyes on it, the better. So if the pharmacist is looking, the doctor is looking, and don't forget, the patient, him or herself. You got all eyes on what you're ingesting, what the doses are, how often. That's the way we stay medicine safe.
Awesome.
Thank
you so much, Doctor. It was wonderful having you.
Thank you.
Thank you for tuning in to Aging Gracefully on Suncoast FYI. We'll return right after the break.